How's it going, everyone? Today we're talking about return to sport wearing a brace after knee surgery. ACL, other ligament reconstruction, fracture at the knee. Regardless of what it is, these braces do serve a very important role in that return to play. It's your extra insurance policy, okay? Now, it's not permanent, but your surgeon will have the ultimate say in what they recommend with return to play wearing the brace, practicing with the brace. And then it's important to have a really good conversation and manage expectations and create a timeline for discharging that brace and weaning yourself off of it. In talking with players, coaches, athletes over the years and in my practice, there's perceptions all over the map. There's preferences all over the map. Some people really see the value in them. Some people hate them. Some coaches really dislike them. Other coaches see the value in them. Not to say that the other ones don't see the value, but there is some truth to the matter that if you think you need this permanently, you're not gaining that confidence. And we want you to be confident when you go back to return to sport. You have to be confident. You have to be physically ready to be able to return to sport, right? This is just an insurance policy. And at the end of the day, we want to make sure that you're confident whether you're wearing this or not, because again, the goal is to get you off of it. Now, by all means, you're allowed to continue wearing it as much as you want if you really love this thing and you want to sleep with it at night and if it makes you that much more comfortable and confident. But there should be some practicing weaved in, whether it's on your own in a controlled environment with drills or in a practice where you're actually practicing without it after a certain point when it's been discharged or you've been cleared for discharge from the brace. There is some kinesiophobia associated with these, meaning you're going to move awkwardly. It's something extra on your body. It's not going to feel natural. Some athletes find them downright annoying. So that's one of the reasons it's really important to have a good plan of attack going into this. You should be wearing this not just for practice, not just for play. You should be wearing this throughout the day. You should be wearing this when you sit in a chair, when you walk around, go up and down stairs, go do errands. The more you can desensitize your body to wearing this and become used to it, the better off you're going to be when it actually comes time to play and move the way you're supposed to and react the way you're supposed to. Okay, so that's one of the first things you should do as an athlete is you should absolutely wear this and be comfortable wearing this at all times, not just for practicing, not just for competitions once you've been cleared for return to play. So the kinesiophobia aspect of it can definitely be addressed with some smart, intelligent design in wearing this throughout the day. So that takes care of that fact. Now, the other aspect of this is that you want to have the confidence as well. And so at a certain point, you should be practicing your strength training with and without the brace when it's appropriate. You should practice some drills with or without the brace when it's appropriate. You should be practicing on the pitch, again, when you're cleared for discharge, without the brace as well. You need to eventually get to the point where you can wean yourself off of this brace, where you don't always need the insurance policy. We just want you to wear it in the first few months post-op, which is the most common time frame for an athlete to continue to wear this for, that 6 months post-op and return to play. 6 months post-cleared return to play back in competition. Sometimes the surgeon wants it for up to a year. There's an adaptation period where your body is not going to be used to a different opponent, right? You can never practice as hard as you're going to play in a competition against somebody on a different team. All right, that's just the bottom line. So it's always good to have that as an insurance policy, and you want your body to be safe during that adaptation period. That's why the surgeons want you to wear it. That's why we recommend athletes wear it, especially if they need a little bit of an edge, a little bit of that confidence. Now, I've had some athletes where they just say, I want it, I hate it, I move awkwardly in it. And then I tell them, have a conversation with the surgeon then. See if there's a way we can modify or tweak the brace that'll make it more comfortable for you. And again, I have some athletes that have just ditched it and they have a conversation with their surgeon and it's they're better off for it. So again, the pendulum can swing both directions, but you have to be comfortable wearing the brace, all right? There is a purpose for it, and the goal should always be to wean you off of it, all right? The medial lateral buttressing of the brace, side to side, front to back, really provides that insurance policy for you, which is important. That's the return on investment here, all right? The opportunity cost is obviously wearing this for a short period of time, but the goal should always be to continue to prepare yourself to be as best as possible physically for competition purposes and performance purposes, and then you can wean yourself off of this. So you don't have to worry. You're not going to be wearing the big Bledsoe braces, the whole time. These are definitely a thing of the past. Technology improves all the way down to the competition ones and the performance ones that are as streamlined as possible and minimalist as possible, but still providing adequate support for you. So we know not everyone likes the braces, and we do get the question a lot of whether you have to wear them with return to play. And the answer is going to be yes for a short period of time we suggest that while your body adapts and you go through that transition period, getting used to the new rigors of full contact, full competition against external opponents, not just your teammates in a controlled environment. So there is value to them, but it's also very individualistic. You must talk with your surgeon, talk with your rehab specialist, and come up with a good plan of attack for what's going to be most important for you. If you guys have any questions on this, obviously let us know. It's a great topic to talk about. But until then, if you're wearing one, get after it, keep training. Wish you guys the best. And again, reach out. You know where to find us.